Shock is defined as inadequate blood delivery to tissues. Common signs and symptoms include persistent systolic blood pressure measurements less than 90, mean arterial pressure less than 70, tachycardia, elevated lactic acid, cold and clammy skin, oliguria, and confusion or disorientation. Common diagnostic testing for shock includes multiple blood pressure measurements, heart rate measurement, lactic acid and serum electrolyte tests, and urine output measurements. Other diagnostic tests can be performed to assist in determining the source of the shock. Hypovolemic shock is the most common type of shock. It is caused by internal or external hemorrhage or loss of fluid. Vomiting and diarrhea are the most common causes of hypovolemic shock in children. Other causes of hypovolemic shock include burn and urine loss due to diabetic ketoacidosis or diabetes insipidus. Cardiogenic shock is caused by heart failure. Damage to the heart muscle from a myocardial infarction can lead to cardiogenic shock. Other causes of cardiogenic shock include cardiomyopathy, congestive heart failure, or valve conditions. Septic shock is caused by systemic infection resulting in vasodilation leading to hypotension. Vasodilation is the widening of the blood vessels which leads to decrease in blood pressure. Anaphylactic shock is caused by a severe reaction to an allergen or drug which causes widespread vasodilation, leading to hypotension. The main goals of treatment for shock are to maintain the patient's blood pressure. A patient being treated for shock will have their legs elevated and head placed down to help the blood return. Patients in shock need to be kept warm. In addition, shock is treated with drug therapy, fluid resuscitation, and blood products. Dopamine, dobutamine, and norepinephrine are given to increase pressure in the arteries and assist the heart to pump blood. Antibiotics, corticosteroids, and IV fluids are given for septic shock. Anaphylactic shock is treated with diphenhydramine, which is also known as Benadryl, epinephrine, and steroid medications, including Solu-Medrol. Cardiogenic shock is treated by identifying and treating the underlying cause and the symptoms of the shock. Hypovolemic shock is treated with IV fluids and blood transfusions in severe cases. Common clinical indicators for shock include acidosis, blood loss, chest pain, confusion or delirium or disorientation, cool extremities, dehydration, drug intoxication, head injury or recent head injury, hypotension, irritation, infection, oliguria, sepsis, abnormal systolic blood pressure, tachycardia, tachypnea, trauma, and burns. Common diagnostic tests for shock include blood pressure measurement, heart rate measurement, lactic acid levels, serum electrolyte test, urine output measurements. Common therapeutic treatment for shock includes antibiotics, blood product replacement, corticosteroids, diphenhydramine, also known as Benadryl, dopamine, dobutamine, epinephrine, IV fluid resuscitation, leg elevation, oxygen therapy, norepinephrine, Solu-Medrol, warming techniques. Possible query options for shock include septic shock, anaphylactic shock, cardiogenic shock, hypovolemic shock,